Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jacqueline Meredith. Today's episode is a first of an ongoing series addressing collaborations in care during the course of hepatitis B infection, featuring brief conversations between a physician and a patient. In this episode, Dr. Nancy Reau has a discussion with her patient who shares her experiences living with hepatitis B and hepatitis delta, highlighting opportunities to optimize care. For the full online educational program, including medical minutes, downloadable slides, clinical thought commentaries, and other podcasts in this series, please visit the link in the show notes for this episode. And to get access to all of our new podcasts, subscribe to the CCO Infectious Disease Podcast on Apple Podcasts, Google Podcasts, or Spotify. Now let's get started.
Hello, my name's Nancy Reau, and I'm a hepatologist at Rush University Medical Center, and I'm joined by my patient who has hepatitis B and Delta virus. Thank you so much for joining me. I want to really communicate your journey through this because I think that Delta patients in the United States do go through some hurdles while they navigate diagnosis and treatment considerations. And I think your story is very special for that. I'd like you to start by just telling me a little bit about how you learned about the hepatitis B virus.
Of course. Hi, you can call me Sarah, and I am a chronic Hep B and D patient, and I'm under Dr. Reau's care. I was originally diagnosed at the age of 3, and my mother informed me that when I was 3 years old, I was very sick and admitted to hospital, and I had to receive a blood transfusion due to that. So my disease was possibly from being exposed to reused needle or through a Hep B infected person, the blood transfusion during. So up until the age of 8, I was under medical watch, and for some reason, my mother had the misunderstanding that during the lab result, my Hep B virus was inactive. So she interpreted that was cured. So since then, I never followed up until my first pregnancy, pretty much.
Yeah, and so it's pretty standard to be screened for hepatitis C and B, originally B and now both viruses during pregnancy. And so I imagine that was a conversation that your obstetrician really didn't have with you. It was just a standard lab. And then when it came back positive, how was that communicated to you and what did they do next?
So during my first pregnancy, that when I find out that I still have Hep B, they recommended for me to follow with hepatologist, which is news for me because I was very shocked and kind of disappointed that I never followed up with my virus. Then I began to search for GI doctors. During that time, I was informed by my doctor that there was no medication or cure for my disease and that I had to wait for new medication to come out. So little by little, I started to educate myself with the Hep B virus and made sure that my child got vaccinated against HBV. And I heard it was possible to have HBV transmitted through pregnancy. And of course, I made sure there was no occurrence within her. So I made sure to protect my at least loved ones, that they don't have to go through what I go through. I feel like the information on my mother's end was inadequate enough. So I feel like doctors should have followed up on the disease, educate family or patient to give overall overview of what expected. And it's like there was no communication between us or medical team. Therefore, like leaving us like unknown, some obstacles coming on our way.
How about when it was communicated by your obstetrician? I know that sometimes our OBGYN doctors are very good at knowing, the screening studies and very knowledgeable about pregnancy themselves, but how was that handoff? I mean, did they reassure you that your disease was mild and that you just needed to have follow-up, or were they able to kind of communicate what it meant to have hepatitis B?
Well, they actually gave me like overview of Hep B, and then they told me that, inform me about Hep B, making sure that not to pass on to your child. And of course, they definitely referred me to hepatologist, and that's what I did.
Perfect. So that sounds a lot smoother than what might have happened, originally. And, our understanding of hepatitis B and Delta have definitely evolved over time. And so messaging from 20, 30, 40 years ago might be very different than what we're able to communicate to our patients now. And I do think that, sometimes things do get lost in the shuffle a little bit, especially when you as a child were very ill and now your mom was just so happy that you were healthy again, that some of the rest of it is a little bit confusing. Let's kind of move forward. So I think that knowing you had Hep B and kind of empowering yourself to have knowledge about that allowed you to at least feel in control again, even if not able to be cured. And then how did you find that you were co-infected with Delta?
So co-infected with Delta was when after my second child was born, I decided to visit my family in Mongolia. And during that time, I thought it wouldn't hurt to check with the doctors over there. And I tried to do the Hep B testing, and they actually recommended me to check my viral load, Hep B viral load, same time Hep D, because they said it's a co-infection with Hep B. So that was a possibility. So that's what I did. And then I found out that I have a Delta virus as well.
And I think that you've already given us information in the United States, Delta and hepatitis B are relatively uncommon for people born in the US. But for countries like Mongolia or Romania, Ukraine, Middle East, there are other places where Delta is more common. And the physicians and the clinicians are much better at recommending proactive testing. So after you found out you had two viruses, why don't you talk to me a little bit about the journey for management and what they told you what to expect about your disease course?
Initially, like you said, like I never heard about Hep D before at that time, so I was a little lost. And after my test, I tested positive Hep D, and they informed me that I should start on Hep B medications. And when I arrived back to US, I arranged an appointment with hepatologist at Rush Hospital. And then doctors here recommended me to start it on TAF. And later on, I changed to oral combination medications.
Did anyone talk to you about treatment with interferon for your hepatitis D?
Yeah, so I've always wanted to inform myself and trying to find if any other new cures coming in a way. So that's where I found out that from my team that there is some clinical trials that possibly help me with the Hep D, and I started on the trial.
Perfect. So I think it's important for people who are listening that controlling the hepatitis B is really important, and our oral medications do a great job with that, but they don't have much effect for Delta. And your original clinician retired, and that's why you and I are together now. But I think that knowing that there was an opportunity that might offer ability to treat the Delta is important, but it's more challenging because there aren't a lot of approved treatments for Delta in the United States. Most of our patients would be offered pegylated interferon as the only option, but at Rush, we had a clinical trial that was open that you participated in, and that was a great opportunity. Unfortunately, that opportunity was not 100% effective for you. And so I know that we were disappointed, but now looking forward to newer treatments in development and maybe using some things a little bit earlier than the approval process. We're hoping to appeal. I'd also like you to talk a little bit about the positives and negatives about this part of your journey, because I'm sure your original clinician talked to you about the fact that the two viruses together are more aggressive than the one virus by itself, and that the chance of developing more advanced disease or liver cancer is higher.
That is correct. Yeah, he informed me, my previous clinician informed me that there is a higher chance both viruses are very aggressive and it can damage my liver further to liver cancer, leading to liver cancer. So that's why I really wanted try out some trial medications. So if it can help me with my Hep D virus. And unfortunately, during that time, my viral load was initially started a little bit high and then start going down, which was make me very happy. And then latest, my lab result shows that I have Hep D viral load came back. So that was my positive and negatives. But hopefully that Hep D would diminish after, the new medication that's coming up. I have a high hope for it, even though negative side effects I had experienced. But for me, it's like definitely knock down the virus, and hopefully both viruses can be down, and it's going to help me with my liver regenerate.
What about the positives and negatives for your medical journey? Why don't you talk to me a little bit about what went well and what didn't go well as you traversed your multiple caregivers for your hepatitis?
So positive is definitely, I'm very glad that I am in great care right now, and I have informed really well what's coming on my way, and at least I have opportunity to take the care in my hand. And since I was not a child anymore, and at least I know I can educate myself also. So that was my positive. And then negative would be generally, really, I would say that healthcare teams, they need to have a good conversation with the client, patients, so that way they can communicate with the patients or with their families. I think that would be the best thing, and educate them as well.
I do think that sometimes we say the same thing, but in different ways, and that can be confusing for the person listening. They think that you've told them two very different stories when we think we've said about the same thing. And the healthcare system is fractured. It's hard to have more than one provider and make sure that those providers are communicating well to each other and, working with the patient to make sure that it goes smoothly. I feel fortunate that I work at a place like Rush where we are collaborative, but we also have opportunities that other facilities may not have, like clinical trials. And Sarah, hoping that we can continue to make this easy for you and not disjointed.
Yes, definitely. I agree. And same time, I have multiple doctors throughout this journey, like in a different country versus United States. And then, of course, the living situation was there as well. So that's why, at least right now, I'm in one care and they can communicate well.
Well, I think we definitely are looking at the drug development pipeline with a lot of enthusiasm.
Mm-hmm.
The medicine that we're hoping to get possibly early access to, or when it's actually approved, is very exciting, but it is not the only thing in the pipeline. The literature or the clinical trials are working towards finding curative treatments for hepatitis B, which would obviously also cure Delta, which is an obligative virus. So you have to have B in order to get the D. So I think this is really exciting. And I imagine as a young person, so I know on this podcast, you cannot see how old Sarah looks, but as a young person with still young children, we want to make sure that we offer you an opportunity of longevity. And looking at where science is headed, I do have confidence in that. We do go up and down. So I also thought you were doing, even though you had a lot of side effects, the virus had responded nicely and unfortunately relapsed when the investigational agent was stopped. And unfortunately, that agent will not be progressing towards approval because it did cause side effects that were not felt to be worth the risk. But I think that it is only one of many, and we definitely need good treatment choices for our patients with hepatitis B and D.
Yes, and of course, even though my virus is back, I still have a high hopes in scientists developing new drugs. And I think anyone who is experiencing the same obstacles as I am should never lose hope in their health. And good things come with the time, and only a matter of time before we all can receive a cure. And feeling doubtful is always mental. We need to disregard any negativity, negative thoughts. That's what I'm at right now.
Absolutely. And you've been a trooper through all of this. So we're hoping that this does have the fairy tale happy ending.
Thank you.
All right. Well, thanks, Sarah.
Thank you very much to Dr. Reau and her patient, and thank you to our learners for joining in. As a reminder, to view the full Mind the Gap, Aligning Real-World Practice with Best Practice in Hepatitis B Virus program, on the Clinical Care Options website. Click on the link in the show notes. And please be sure to check back for more episodes on important infectious disease topics. Thank you and have a great day.